I, it's my privilege to present this very brief and unfortunately necessarily rapidly moving overview on the medical significance of non-front-fang snakes. I would have preferred to be present, but unfortunately was unable to. So I'm going to move directly forward with this, and hopefully I will be able to explain things in the time allotted. So non-front-fang snakes, of course, have long presented a different type of challenge in the to the clinical community and clinical toxinology because of the very limited database about a large number of the species. Of the 4,000 species of snakes, roughly, that we have recognized currently, and I'll show a brief screen on that, roughly 80 to 85%, 3,200 species are non-front-fang species. For the last several centuries, there's been a great deal of speculation as to how medically significant many of these snakes might be. For example, as one very brief example, the Cuban naturalist Don Felipe Poe saw a person who had been bitten by a hubo, which is now known as a Puerto Rican racer known as Borachinopsis puertoricensis, a Dipsadidae family species, and noted that there was some significant local effects. And he came to the conclusion that actually the degree of anger, quote unquote, that a snake would present towards being harassed or interfered with could actually stimulate the conversion from harmless to venomous. Of course, this is inaccurate, obviously. One of the problems with attempting to interpret their medical significance is the tremendous constant dynamic flux of the taxonomy and biological history of many of these 31 or 3,200 species of snakes. Right now, they're contained in roughly 12 to 15 families. I'm not going to go through all of these. We obviously don't have the time, but you can take your attention, really spend your attention towards the 4,000 snake species of extant species that we now currently have, constantly changing and constantly reclassified as we obtain more information about specific groups. And among these, and among those groups that consist and comprise the non-front-fang species, you can see over here we have, for example, some confusing groups that can get in the way of actual direct interpretation as to what non-front-fang species actually represent. For example, the burrowing asps and their relatives, the Atractaspididae, have been shuffled back and forth between several different taxonomic groups and consist of a group that contains front-fang species as well as a subfamily that contains non-front-fang species. And this can confuse people unfamiliar with the taxonomy and biological history of some of the snakes, particularly clinicians presented with a patient envenomed by an unfamiliar species. Then, of course, we have the front-fang species, such as the Viperidae and the Lapidae. You can see these are in red because among these groups, they have resulted in human fatalities. Whereas in purely non-front-fang groups, such as the Cimophidae, there have been cases of significant local envenoming and one case of systemic envenoming, but there have been no fatalities, human fatalities. Whereas in the Colubridae, which used to contain a large number of these species inaccurately, all grouped together, at one point was roughly 2,000 species. Now it's been shrunk to about 850 species. There are several species that have killed humans, such as the previously mentioned boomslang, Dysphylitis typus. And then there's a number that are, for the yellow part, that have produced a larger number, that have produced local morbidity and local envenoming of different severity, and the factors that influence that I'll briefly mention shortly. There's also the group Dipsadidae, which is a growing group of importance, neotropical group that contains about 850 or so species, that also contains a number of species that have produced local morbidity and notable local envenoming, but only 2 species that are assigned with producing potentially systemic effects, of which one certainly has produced systemic effects and must be considered potentially life-threatening, but there are no deaths associated with any of these. Natricidae is another group that still by some authors is recognized as a subfamily of the Colubridae, but also contains roughly about 600 or so different, about 260 or so different species that also contain a few that have caused human fatalities. Most also can produce just minor to moderate local morbidity. So what is the difference between the term non-front-fanged and front-fanged, and the terms venom gland and Duvenois gland, and all these terms that some of those present, I'm sure, have heard many times and are familiar with, and some may not have. And the key is on the left. If you see, this is a model non-front-fanged species, which has almost no muscle insertion or muscle fiber insertion into this gland, which is considered by some the same as a venom gland by any other species, and by myself and colleagues is considered a homologue because it functions a bit differently. And that is that it's a low pressure system, meaning that it produces its venom on demand, so that actually palatomaxillary jaw advancement, jaw movement, which is sometimes incorrectly called chewing, stimulates a cholinergic stimulation of the production of the secretion from a various populations of cells that produce the toxins. There is no stored bolus of any significance of the venom, and it's associated with dentition in the maxillary teeth that may or may not be modified or enlarged, or contain an external groove that can be deep or shallow, or just a flattened depression. This is highly variable, and it could also just have isodont teeth, which are basically teeth the same size, that are just associated with the secretion or venom being released generally into the oral cavity. This is a great contrast with a prototypical elapidoviparate snake, which has direct muscular attachment and insertion of fibers into the gland fundus, and is associated with a closed system, meaning a canaliculated fang, a fang that is a closed lumen and is exerted under pressure of a stored venom bolus, and could be injected very deeply into the integument of a bitten prey or an unfortunate human. The measured PSI in the few species that have been studied of non-front-fanged species is less than 5 PSI, whereas in the measured proteroglyphs, if you will, or lapids or viperids, it is technically 30 plus PSI, which is quite a significant difference. That's similar to tire pressure. So here's an example of several fangs that, that kind of illustrate the difference between what is sometimes seen in non-front-fanged species, which is on the right, which is the western hognose snake, Heterodon nassicus, which is almost like a blade-like, really unmodified tooth except for its size, and it's located in the posterior maxilla. Whereas you can see in Russell's viper, it is exactly beveled just like a hypodermic needle, and in Nahacayuthia, the monocle cobra, you can see that it's also beveled, very similar to hypodermic needle. There's a visible suture present in the Cayuthia fang, whereas in the Russells, it is literally a smooth surface. So here's a classic case of a Dysphylitis typus, which was mentioned recently. It's a medically important colubrid non-front-fanged species. You can see there are multiple enlarged posterior maxillary teeth. All of these are very deeply grooved, associated with a serous Duvenois venom gland, and has produced a significant number of human fatalities. The fang, if you will, or the enlarged maxillary tooth preferably, is deeply grooved, almost about 2/3 of the length of the tooth, and there is also a very sharp spear-like edge to the apex as well. This is very variable, and I only have a brief moment. I'm probably going to go over just by talking about this at all to describe a bit of this. I do think it's important. The term rear-fanged is always used for non-front-fanged species, and I would argue, and many others have argued, this is quite inaccurate because, for example, Tomodon dorsatus, a Dipsadidae species, the pampas snake, has deeply grooved posterior maxillary teeth that are not posterior. They're actually midway in the maxilla, and you can see they're located in this area here. This is a boid, which is obviously a henophidian. It is not technically a non-front-fanged species. It is an emerald tree boa, Corallus canina, that has very notably enlarged anterior maxillary teeth, which are obviously meant for grasping prey, such as birds or opossums, and prevents their escape while they're getting constricted. And these can inflict very significant wounds in humans, I can tell you personally. And they produce what can, in some persons, can look like mild local envenoming when the snake attaches and refuses to release. This is Amblyodipsis polylepis, which is a purple glossy snake. And you can see some have a large diastema between the anterior and enlarged posterior grooved maxillary dentition. And this is very likely due to positioning of prey that therefore functions, this tooth may function as a restraint method as well as a means to inoculate the prey with venom. There's great variability among all these groups in this. So very briefly, we know very little about the venoms from non-front-fanged species. Of the roughly 3,100 so species that we know of, roughly 30 to 35 have been studied for their venom components. And what we find is snake venom metalloproteases, 3-finger-fold toxins, cysteine-rich secretory peptides, and C-type lectins occur fairly frequently in those that have been studied, whereas components that are more commonly found in front fang species, such as L-amino acid oxidase and phospholipases A2, have been found much less frequently. That's a growing list, and that I would obviously argue is because of the lack of study of a large surveyed number of species as opposed to reflecting real natural distribution of these components. It is important to recognize that with the increasing reliance on genomics, transcriptomics, we need to interpret some of these earlier data in a bit more cautiously before assigning them as clinically relevant components for a given venom studied in these less studied species. And of the components that have been studied, less than 20 have been thoroughly isolated, characterized, and really carried through a typical type of full characterization investigation. So what we really have here is, this is a study that's been going on for a couple of decades with colleagues, and I would say that we have a work in progress, but it is also progress. We do not have enough data from evidence-based bite records and from personally managed patients to be able to do thorough statistical analysis. The numbers are way too small, but we do have a growing database, and we're learning more about representatives of different clades and different groups that can give us more information about human medical risk from these lesser known species. For this study that was derived from a lot of this work, there's some quantitative scores that are assigned due to different measures that are seen, but there's also qualitative evidence-based risk determined by the modified strength of recommendation taxonomy. So what are some of the, very briefly, what are some of the things that influence the severity, since they do not have a stored bolus of venom? So there's a belief that there needs to be a prolonged attachment of some of these snakes to produce a greater effect in humans. Now, let's see. You can see this is a mangrove snake, Boiga dendrophila, which is being provoked to bite. And you can see now that gave a good bite to this gloved hand, and it's holding on, and you could see it's slightly advancing its jaw, but it releases. Now, in comparison, here's another forced bite. And you could see this now is more of a stimulation of the snake actually grasping onto the finger. Now, I'm not going to have time to show the entire video, but you can see it's starting to do palatomaxillary advancement as it's sensed the contact with the finger, almost as it would do with seized prey. Now, what's interesting, of course, is in this species, which is very popular in captivity, as many of you know, and is also popular in snake handling shows in Southeast Asia, you can see here we're at 42 seconds, and it's still gripping quite significantly onto the finger. Here is it over a minute, and you can start to see here, if I hold it, that the finger here is literally bathed in mixed oral secretions and certainly is venom as well. And so as the snake is inflicting wounds into the seized digit, there is a flood of these secretions that is obviously bathing the wound or wounds. Now, in this, I'm just going to show you briefly, the operator is purposely pulling away from the snake. The snake is not letting go. And in fact, it actually stimulates the snake to grip a little harder and to advance further. You can see right there, to the point where we're now at 1 minute and 40 seconds, and this has overflowed the finger and has bathed it completely. And so with some species, prolonged attachment can certainly play a role, but that is a misnomer to believe that is the case with, for example, species like boomslangs that you've heard a little bit about, where quick release, attachment, quick release can result in a fatal envenoming. So this is only with some species that are related with more local morbidity from what we have seen in this limited database so far. So in order to determine the risks involved in these, we've kind of developed a stratification system. Level 1 is potentially fatal. Level 2, you can get systemic envenoming, but most of the time it's a local morbidity of certain levels of severity. And the third one is really what I was just indicating, is many species fall into this group where you get mild to moderate local effects, often very few effects, unless there is a protracted attachment. And then the more common category with many of these species is the level 4, which is, transient bleeding, transient edema, local erythema, and so forth, and pain. So here's an example of a hazard level 4. This is Hemorrhoius pneuma for a coin snake, a colubrid. This bite occurred in Israel. You could see this is a mixed picture of local hypersensitivity type 1, as well as local envenoming. And hypersensitivity confuses the picture in some of these bites. There's all kinds of incorrect information spread all over the internet that hypersensitivity has nothing to do with bites like this, and that is totally inaccurate, that there is a hypersensitivity element in some bitten patients. This is a bit more significant. This is a bite from a captive western hognose snake, Heterodon nasicis, which is a dipsatid species, probably the most popular captive snake in the US, parts of Europe, and Southeast Asia. This resulted in this blistering effect and quite a bit of disability for several months, and required almost 8-9 months for total resolution. And you could see that some clinicians being presented with this, not being aware of the biological history and with herpetological subjects, might consider this to be a crotaline envenoming, which would be an understandable assessment in many cases. On the left is Heterodon platyrhinus, the eastern hognose snake, and on the right is Heterodon nasicis, the western hognose snake, two very popular snakes in captivity. Bites from these are very rare. They're not common at all, almost always associated with feeding results of owners handling them after handling a food item or after the snake has been stimulated and has been eating. This is a little bit more now. We're getting into the hazard level 2-3. This is a classic example of what I was pointing out, where you can have rare systemic effects in this group. This is a bite from Phalodryas ophrosai, Lichtenstein's green racer, a medically important species in Brazil, that produced distal ecchymoses of significant size from the initial bite site. They have to be considered to have the potential to inflict a life-threatening envenoming because of this. But unlike a couple of touted reports, they have never inflicted a documented fatal envenoming, but they must be considered potentially capable of doing so. This is Lichtenstein's green racer, Phalodryas ophrosai, medically important in Brazil. This is another case where, again, a person presented with this bite from this Leptodyra frenata, a rainforest cat snake in Guatemala. Professional herpetologist, protracted bite on the finger, and obviously sustained a bite that could easily be interpreted as a mild to moderate crotaline Bothrops species envenoming. This also was slow to resolve, with some remaining sensation deficits, but there was complete recovery of function. This is a historically important example of a fatal Dysphilitis typus, a boomslang envenoming with recumbent ecchymoses from a hemorrhagic diatheses. and is a classic example of how very serious the bleeding disorder, the hemorrhagic disease can occur from these type 1 hazard 1 non-front-fanged species. And this is a perforative hemorrhage, temporal occipital hemorrhage, and a tragic envenoming in a teenage boy who was bitten by a Rhabdophis tigrinus, a tiger keelback or Yamakagashi in Japan, a natricid species, which is, you could see, is dissected on the lower right. This is Rhabdophis tigrinus, the Yamakagashi. You could see this very serous, large Duvenois venom gland that is associated with non-grooved, enlarged posterior maxillary teeth. This is the redneck keelback. This is a Thai specimen, which we now know has produced fatal envenomings as well. Previously was only associated with non-fatal bites, but these now are known to being producing, and probably are very underrated as medical importance in parts of Southeast Asia, Rhabdophis subminiatus. This is a boomslang, Dysphylitis typus, and this is Thelatornis capensis, the South African twig snake, which is a species also that has produced human envenoming, fatal human envenoming. This is a colubrid, this is a colubrid, this is a natricid, and this is a natricid. So now there's a few things more updating this a tiny bit further. This is a case of a professional herpetologist recently was handling an African emerald snake, Hapsidophris maragnatus, which is a species that is imported into Europe and the US occasionally, and is very attractive and is an inoffensive species, but he was bitten by it and did not have any immediate effects at all. No real signs of even tooth wounds, no puncture wounds, nothing really significant. 13 hours later, he came up with this very, very pruritic, mildly painful eczematous effect from the bite. And this is a definite demonstration of type 4 hypersensitivity. And so again, and this is about a week later, roughly, 5-6 days later, you could see that there's a little milia in the area and some residual dermatological resulting sequelae, but it all healed up. The key is that this can confuse the clinical picture. There are definitely type 1 and type 4 hypersensitivity occurs with bites from some of these snakes. Another case of a adventurous professional herpetologist, I assure you known to everybody, who was handling a Reinhardt's snake-eating snake, not exactly well named, Polemonicanthus, which is in the aparolactine subfamily of the Atractaspididae. It is a non-front-fanged species. He developed a very significant blister, very reminiscent of some minor to mild Atractaspis bites on the tip of the finger, which was very slow to resolve and eventually produced this exfoliated effect in the finger. I might add just briefly, very quickly, that there was a local physician who saw this, who immediately wanted to surgically debride it, and fortunately listened to us and did not. And he got complete resolution. This is a Polemonicanthus, a very little known member of the aparolactine Atractaspids. And this is the emerald green snake, which is the Hapsidophris maragnatus. So what are the conclusions from this ongoing study? Is none of these should ever be taken for granted, particularly with the very limited database we have about a large number of them. Assumption can lead to very bad results. Medical professionals should always seek informed counsel about species that a patient has been bitten, of which they are unfamiliar. Unsupported assignment from components from genomic studies, transcriptomic studies, should be very cautious because we don't have enough information about their actual biological function in many cases. And immediate and delayed hypersensitivity can significantly contribute to the clinical effects and progression in some species, in some patients bitten by some species. And of course, we need continued formal documentation of these bites in order to formulate a well evidence supported database. Thank you for your attention. I'll be happy to take questions if there's time.